Hi, I'm Dr. Martina Karlo from Dentelli. Today we're going to talk about whitening. It's a common question my patient asked me, and I'm going to try to give you an answer today. So whitening can be a lot of things. We can whiten the teeth also with just simple sandblasting, or to use some toothpaste that has a little more abrasive particles, because they remove the outside pigmentation of the teeth, let's say the stains from the food, from the drinks, wine, etc. So then afterwards the teeth will be whiter. But this is only temporary, because the minute we're going to intake all this again, it's going to stain again. If we talk about the real whitening from the inside of the tooth, then we talk about using some agents like carbamide peroxide or hydrogen peroxide, and it's the difference just in the percentage of the active thing that works. For example, in-office bleaching can be 35% of hydrogen peroxide. Home kits have 16%, and then you have these commercial things that have, let's say, 6%. They all work, but of course, the more the percentage, the bigger the result. So how do they work? Because patients always ask, is it harmful? Is it going to damage the teeth? Are the teeth going to be sensitive, etc.? So I would say no. If done correctly and if done in a normal usage, then no, it's not harmful. So the active part is a hydrogen molecule, okay? And it just breaks apart the pigment of the tooth. It's called chromogen. And it only works on that, not on the enamel, not on the dentin, not on anything else. So it doesn't damage the tooth in that sense. It only breaks the double connection into a chain, and then it reflects the light differently. So that's how the teeth become lighter, let's say. So if used correctly, what does this mean? For example, you do the whitening in office bleaching with a 35% hydrogen, and you have done the maximum effect. It's only the dehydration, because you stay 2 hours like, you know, without saliva, without water, and then the teeth get dehydrated, and that's the only reason why the teeth are sensitive. But this will pass immediately as the saliva comes back on the teeth. They will rehydrate and they will be normal again. So it's nothing to worry about. But if patients use the home kit, and if they use it, let's say, every month, every 2 months, or very often, then yes, the teeth can become very thin. Then yes, the enamel can get damaged, in the sense the teeth become gray, or they become even more yellow, because the dentin is the structure below the enamel, gets to show, and the dentin is more yellow. So please consult with your dentist how much, how often, and which percentage is to be used. I always recommend to do the in-office bleaching, because then we can control all the environment. We can preserve the gums, because sometimes in the home kits you put the jelly also all around, and then it can damage a little bit the gum. You cannot take care so good as the dentist would in the office take care of the gums. I like whitening, and it will always get the most white nuance from your teeth it can get. And let's be honest, every smile that is whiter is more appealing, it's considered more prettier. So I always recommend my patients to do the whitening, only in consultation with your dentist.